Hello, my name is Andrew Kohlmeyer, and I would like to talk about lower leg complaints. And this is a medical massage approach for lower leg issues. So basically, you have your tibia and your fibula, and in between that is where all your balance would be. So if someone comes in and they say they don't have proper balance, there would likely be an issue with maybe overpressurization in this area, so that the compartment would be too tight, or it's mineralized in there, so you would have to get in there and kind of see what's going on there. So you'd want to address that by taking any mineralization out of there. And also, what can cause that too is the gastroc muscle right in here can have mineralization right at the tendon end of it, and it's usually right about there, and it's pretty painful to remove that. So it'd be the same thing. You'd be looking right about there, and that's like the computer center for that muscle. So it'll lock that muscle up, and then they'll lose compartmental space between this fibula and tibia. So it's important to check that muscle out as well. Make sure that's not really mineralized. Usually it'd be a little bit of mineralization towards the top end of it when you have that, and that's just so common right in there. And you want to warn your client, or just be aware yourself that it's going to be pretty painful right there to remove that. But not so bad, but it is going to cause some pain. It's basically like broken glass right in there when you remove that stuff. That's what it feels like. So other than that, you have foot complaints. So basically what runs down into your foot is these connective tissue tubes, which are known as tendon sheaths. So your muscles run down inside these tubes. So if you took everything out, it would look like a pipe organ. There's like 20 of them. So you have to clean those out. So again, it would just be like cross fiber fiction across these tubes, tendon sheaths, and that'll help clean that up. So what you're going to gain out of that is more control out of the foot. You're going to be able to move these toes in relation to the ground surface you're on or whatever. And another thing is basically at the joint of each toe, you're going to have these they're like magazines, I like to call them. It's like it kind of like holds between the tendon ends, and you have that little magazine in there. So if you have pain in there, it's like you have to like kind of pill roll that, and it'll help get the mineralization that's between the bone and that little magazine that kind of holds that joint in place. So you have to go in there between those, and between the bones too. You want to check between the bones, so you want to clean out between the bones. And I commonly just kind of scrub them out. You're looking for soft tissue mineralization. Anything that feels crunchy in there, you just kind of want to crunch it up, and that'll help. And then you'll have more flexibility into the foot, so that you'll be able to like trip over something and catch yourself, as opposed to just falling over. And so basically here, this area here is basically all your plumbing will run up on the inside of that fibula and down into your toes. So if you're having like complaints of cold toes or blue toes, you want to check underneath there and clean that up. Get up in between the bones there, right in the back there, the posterior side, and that'll help with cleaning that out. So basically there's two connective tissue layers in there, and all this plumbing has to kind of pierce those layers and emerge out through the front of the leg. And that's what gives you blood flow to the top side of your toes and your toes. So often that is a good way to bring some more blood flow into the toes, so your toes are just warmer and more nourished. Sometimes with diabetes, that'll be a pretty common thing you'll have to do, or any other reason. Runners, they often get pretty tight in there. And so that's pretty good. It's a pretty good explanation of lower leg complaints. If you have any other complaints you would like me to demonstrate with lower leg stuff, just post in the comments. All right, thank you. Bye.